pinned one level, one segmental joint level bone, right? And then we moved everything that was above it around that point, correct?
Correct.
Or I could do it on this side, pin one level and move him around it, right? Okay, well now we can do it with a very nice circumduction motion. So I am going to take my left hand here, and I am going to have a V with it. Notice I am not going to pincer in like this. I'm going to have a flat V, and I'm just going to go right in against him until I'm against facets on one side and facets on the other. Yeah, from the back, not from the front.
Yeah, no.
Okay.
This is karate.
Yes. So my goal here is to pin one vertebral level. I then hold his head with my other hand here. Now, if I simply bring him into left lateral flexion, I am mobilizing the joint.
Right side.
That is primarily the right side. That is at the level of the pinned bone and the bone above it. Right?
Yes. Yes.
And if I bring him toward me in lateral flexion, it's the same idea, but primarily for the left side, yes? But I can make it nice and rhythmic, like this. Well, it's not technically rotation. This is rotation.
Circumduction.
This is flexion, right lateral flexion, left lateral flexion, extension, left lateral flexion. When you round the corners, you call it circumduction. Okay, but circumduction is not rotation. Okay, like this. Now I can move my left hand up as I do it and mobilize different levels. I could go the opposite direction. He has a little bit of a restriction way up there. So maybe I could linger there if I want. Okay? But the idea here is that when I'm in this circumduction circle, when I'm going to the left, I am mobilizing him around my left index finger. When I go forward, I'm not doing anything because there's no pin mobilization here. When I bring him to the right lateral flexion side, I'm mobilizing around my thumb, and when I bring him back, nothing because there's no place to go. So it's exactly. So what it really is, here's a semicircle of mobilization, and here's a semicircle of mobilization. But when you do it with a full circumduction circle, the patient kind of lulls and relaxes, and it's not as severe, it's not as pokey, it's kind of a nice, soft, relaxing way. And I just keep moving my hand higher up, and then I can go the other way, right? Just like that.
You changed a little.
I change the level.
Yeah, exactly.
So I maybe,
segmented it.
and if you get comfortable at doing this, you can change the level just as you move. You can just keep going up like in steps. Okay? Now, he's stabilized against the back of a chair here, which is good. I could even maybe put my belly against his shoulder to stabilize him even more, because I want his trunk to be stable. If you're sitting on a mobile stool, this will not work very well. Okay? If you're on just a flat stool, then you're going to need to really control this motion. When you're really high up, it'll be a small motion, because if I'm holding C1, then it's just the head on C1. If I'm holding C2, I'm moving the head and C1 on C2. If I'm holding C3, I'm moving the head C1 and C2 on C3. If I'm holding C7 way down here, I'm moving the head C1, 2, 3, 4, 5, 6 on C7. So the circle will be much bigger when I'm low and very small when I'm high.
Yes.
The easiest is in the middle, because way up high you have to be very precise, and way down low there's a lot of motion to control. But in the middle is kind of the perfect. So when you practice, do it wherever it's easiest. Do it toward the middle. Now, one or two more things, and I'll let you practice this. Some patients get so comfortable with this that they start to help. They like it and they help you move. And you can take your hands away and they're still moving in circles. So when I feel the patient start to contract muscles, then I usually kind of stop and I just change patterns.
Yes.
And I'll change the patterns around on a patient that wants to try and control and move this. Okay? If they don't, I'll just go in the same direction. You can do it from one side, or instead, you could do it from the other side. It doesn't matter, right? Because you're doing both sides. So, the biggest two mistakes are with your position. First, do not pincer in with your fingertips. And second, you need to get a good broad hold here. Don't do it on their hair, because she'll slip on hair. So you really want to get across the forehead. And you don't want to pincer here either. You want a broad, flat hold. Okay?
Yes.
Let's try this. Go ahead.